Hello and welcome to a brand new episode of Beyond the Optics podcast with your host Tulip Nandu. I'm a computational biologist at UT Southwestern Medical Center, an avid traveler, a blogger, and now a podcast host. Similar to my role as a researcher, which expects me to take an in-depth look at the projects I'm working on, I'm also curious to go beyond the optics for everything that is happening around and to leverage that knowledge to challenge the status quo and think from a different perspective. This podcast is an attempt by me to put the information out there and spark a curiosity amongst the listeners to go beyond the optics and not take the material they are fed at face value. Today's guest is Dr. Jasmine Modi, a PhD gold medalist in Oriental Medicine and founder of Mumbai's Acu-Shastra clinic. With 28 years of practice, she blends in classical Chinese meridian theory with Ayurvedic wisdom, treats everyone from celebrities to post-chemo patients, and co-leads research at Tata Memorial Hospital on acupuncture for neuropathy. So settle in as we explore how the tiniest needles spark outsized healing, from easing chronic pain and balancing hormones to boosting stress resilience. And stick around for quick acupressure tips you can put to work before the outro rolls. So thank you, Dr. Modi, for coming on my pod.
Hi, Tulip. Thank you so much for inviting me.
Dr. Modi, before we start, how about you give us an overview of what is acupuncture and what first drew you towards this acupuncture and naturopathy 28 years ago?
Acupuncture is all about energy balancing. We believe that there are 5 energies in our body and they have to be in a balanced state. So with the help of needles, we try to balance those energy. This is an ancient wisdom. According to the latest science, what we do is that acupuncture is where acupuncture points are the points on your nerve pathways. Okay. And in 5,000 years back, basically what we call as meridians were extensively on the neural pathways. And there were certain points which were easy to access on those nerves, which are called as acupuncture points. So when we insert the needles on those acupuncture points, we are basically stimulating those nerves and activating your central nervous system. That is what acupuncture is all about. So these are the two understandings of acupuncture. And your second question was what led me into this field.
Yes.
So that's a different story altogether. 28 years back, my aunt, she's a homeopath, basically. So when she was practicing in her clinic, she was practicing in a polyclinic where many doctors do come at the same time. So there was this Sujok practitioner who used to come there, and she would take small short-term courses on Sujok acupuncture. That's a Korean form of acupuncture. So my aunt said that, no, why don't you just learn? It will be good for self-help. You can treat people around. So that's how I started learning Sujok acupuncture to begin with. In that, while I was in the process of learning acupuncture, the day we were taught about respiratory disorders and how you can treat breathlessness and asthma and all that. And the same night, I had a guest at my house, my aunt, and at 3 o'clock, 3 a.m., she had a sudden breathlessness, severe asthma attack. We didn't have any medicines at home for asthma. And she woke me up 3 o'clock. Something's happening to me. I'm having breathlessness. Do something. Now, the only thing I had was my book with the charts on it about energy flow. And they used to give us a kit, like some magnets, some seeds, some tape, and all that while teaching. So I took out my kit, I took out the notes, I saw exactly how the lung meridian moves, and accordingly, I tied a magnet on it. And in 10 minutes, she was asleep. And the whole night, I was like sitting and watching her, what's happening with her, what's happening with her. And believe me, that motivated me to such an extent that I want to learn this in depth, because without even understanding how it's working, without even knowing the intricacies of acupuncture, if I was able to help them for like in 10 minutes, she was asleep. I should learn it more.
Yeah.
And that's how it really led to really learning more different forms of acupuncture, in depth about acupuncture. Like my learning is still on. It's been 28 years. And just last year, I did my neuroacupuncture course from Canada. So the learning has been on since then, since that day.
Wonderful. That's the story. People want to hear the emotional story. And from one life that day you touched, now after 28 years, you've touched numerous lives with your profession.
Thousands of.
So, if I'm not wrong, you earned a PhD in acupuncture, right? That's a very
Yes.
niche field. And so, what drove you towards doing a PhD? And is there any clinical study that you did along with your thesis?
Yes, I did. So basically, I learned acupuncture under Dr. Prabha Borwankar. So she was a leading gynecologist of that time, and she left her practice midway and she started practicing acupuncture. And it was her wish that somebody do a PhD in cosmetic acupuncture. In acupuncture also, we have a lot of specializations. And 28 years back, there were not many specialization happening. Right now, yes, there are lots of specializations happening. But that was the time when she wanted me to pursue cosmetic acupuncture. Now, when we are talking about cosmetic acupuncture, no, cosmetic is a very superficial word. It's a very external thing that people, when we talk about cosmetic, it's about glow and wrinkles and facelift and all that. But in cosmetic, in the acupuncture fraternity, we don't like the word cosmetic acupuncture. We like it facial enhancement acupuncture. So in that, what generally my study was that, I'll give you an example. If a person is sick, doesn't his face tell you? Even if he's not uttered a single word that he's sick, his face will tell you. His complexion will tell you. His eyes will tell you that he's not. If you're having cold and cough, your eyes will be watery, and it will tell you a lot about your internal health. So we believe that your facial expressions, for your facial muscles, talk a lot about your internal health, and vice versa. If your internal health is excellently balanced, it has to show a robust expression on your face. So that was whole study about that, how we classify from in to out and out to in. And it has to show and manifest as a strong facial muscle. So automatically the facelift happens. That is the byproduct and side effect of acupuncture treatment. When you are doing that, no, you have a robust facial expression. Your muscles are very strong, very taut. Your skin is very supple. There's good amount of collagen. You don't have to build or take external collagen. It has to build from within. That was the whole study about my PhD thesis.
Wonderful. So coming to your current, the word Acu-Shastra, right, that you've mentioned, and it's a blend of science and a concept of a Shastra, like Hindu Shastra or like Indian traditional Shastra. So how did you come up with this idea of merging traditional Chinese medicine with our Ayurvedic and yogic principles? And what's the meaning behind Acu-Shastra?
Acu is acupuncture. Acu is accurate. Acu is precision. Right? Shastra is science. So acupuncture is a science of precision, a science of accuracy. Like the point is exactly here, it is exactly here. It cannot be 1 mm here, 1 mm there. All right. So it has to be that accurate if I have to reach that nerve. So that is one concept. Again, when I'm talking about science, people feel that acupuncture is not scientific because it's ancient. They don't understand the wisdom of 5 energies. They don't understand the wisdom of... Whereas acupuncture in today's time, with a lot of research which is happening, we are able to understand that it's very deep-rooted and it's very scientific. It's just that there is no explanation which is bridging the gap between the modern and the ancient science. So that is one thing what I wanted, that the science, the Acu-Shastra is a very scientific approach, and I wanted to bridge the gap between both. That was another idea behind choosing the name Acu-Shastra. And when we are talking about acupuncture, there are various methods of acupuncture. Like I said, Sujok is a Korean method, TCM is a Chinese method, then we have a French method, then we have a Japanese method of acupuncture. But when I combine all of them and I combine our Indian system of treating, everybody talks about way of life, right? You need to have a certain way of life to stay healthy. And that is what is the philosophy of Acu-Shastra, that prevention is better than cure. You need to lead a certain life according to what has been, meaning it's very easy to understand way of life through the principles of TCM or through the principles of Ayurveda and imbibe in our normal day-to-day lifestyle. So that is what is the philosophy of Acu-Shastra.
So going into a bit detail of some of your clinical focus and studies that you've been doing, and I've been intrigued by the pediatric acupuncture. And I have two kids, and when you talk to parents doing acupuncture on kids, how do you make it like safe and like child friendly, and what are the techniques that you tell parents to do when you are treating, say, kids? And specifically, what kind of treatment you do to kids?
Pediatric acupuncture actually starts from when the child is in the womb. What I practice is like a trimester shot, which we give it in every trimester to the mother. As the baby is growing, it grows in a balanced energy environment. All the energies are nicely balanced. That is when we start, when the baby is in the womb. So if the energies are nicely balanced, a child enjoys a good physical and a mental health as the child grows up. In our ancient texts, it's also written that these points, what we use in as a trimester shot, basically eradicates the past hereditary factor and the baby starts with a new genetic pool. I don't know how much true that is. Research needs to be done on that subject. But what I understand is that the energies are nicely balanced when the baby is still growing in the womb. And it's like a perfect energetics when the baby is delivered. So that is to start with pediatric acupuncture from the womb. Second is, apart from cold, cough, and all those basic immunity, ADHD children's come to me for, which I don't agree with. I don't agree children have ADHD. I would not label that word. But those are general things that children would come. But I have treated a lot of cases wherein I had a children who's newly born children, 1 month old, and their bilirubin levels are very high. So we had to bring it to a level. I had a child, again, newly born, like 6 months old, and the testes weren't descended. So we helped them to normalize that also. Then we had a child with having TAVC, meaning it's a heart condition wherein the pulmonary vein is not connected to the left atrium and it's connected to the right atrium, and the baby had to go for like a surgery in 6 days of birth. And again, in 3 months, the scar tissue started growing back again. So he had to go for the surgery, but the baby was so frail that they couldn't perform. So that is when I came into a picture, and I balanced the baby and the immunity and made it so strong that he could go for the surgery. So these are the kind of cases that we treat for pediatric acupuncture.
So all these examples that you gave, so of these are all without any incision, or like just to give a perspective of
how I treat them. So basically for pediatric acupuncture, we have various, like if you come for, like if the child is full of cold and cough, congestion, then we have like a moxibustion massage that we will do it on chest to ease up the cough. Then if needling, like a case what I have discussed right now, when needling is essential, then we have special needles which are painless, and we don't keep the needles. Generally for normal patients, we keep the needles for 20 minutes. We just prick and we remove the needle so that the child does not have to sit with the needles. Then we have certain ear magnets, ear pallets that we just stick it on the ear of the child so that the continuous stimulation is happening. So there are various modalities that we use. Seeing the child, seeing how hyper the child is, we decide what to use with them. We have magnets. I had a child patient who was like continuously, the bone density was so low that she was continuously breaking her bones. Continuous fractures were happening. And for that child, we just used magnets extensively for 3 months, and we just got her out of it and built the bone density. Wow. So there are various modalities that we incorporate in acupuncture.
Just a quick deviation. When you talk of needles, is it similar to physical therapy? They do this needle therapy. Is it similar to those things?
That's dry needling what you're talking
Yeah,
about.
correct.
It is very muscle deep only. Whereas here we are not just going muscle deep, but we are going on the nerve. Sometimes it's only on the skin level. So there are different depths that we go into it. Plus, when we are talking about again energies, no, with the help of needles, we balance, we play with energy. So we reduce the energy, we increase the energy from one energy to another, we transport the energy. There are a lot of things which happens when we are treating a patient.
Yeah.
So needles really help me to make that process very smooth.
And this is a follow-up, like it's not a one sitting thing, right?
Yes.
Okay.
Yes. It follow-ups depending on how the patient responds.
Correct. And then coming to one interesting facet, which is closely related to what I study, it's women's health, where your clinic does support infertility, thyroid disorders, hormonal imbalances. So, which of these areas has provided promising evidence so far in your clinical studies?
Now, when you're talking about infertility, thyroid hormones, all are falling under hormones that you balance the hormone well.
Mhm.
All of them work efficiently. Thyroid is a hormone. For fertility, you need a mixed bag of hormones to be balanced and to be functional at the right time.
Correct.
Isn't it? So we have fantastic results for fertility, and there's so much research being done worldwide about how acupuncture is effective for fertility, for PCOD, for thyroid, for all the hormonal disorders. It's amazing, amazing. And there's lots and lots of research been done on that. And in my clinical practice, I see a lot of IVF patients also. So we do a lot of acupuncture assisted IVFs, wherein we prepare the body, we balance all the hormones, we work on the stress level, because stress is also a factor which really puts all the hormones way off the line. So we balance the stress also, we balance all the hormones also. And then we prepare the body, we prepare the womb, and then we send the patient for the IVF. That's how we really work on.
Very nice. Could you share a memorable patient story that has surprised you? Probably one or two that even you were not expecting to come out after that a huge success, or the treatment did work, but even better than what you expected. One or two examples.
One example I can really think of is a patient with GBS syndrome, that is Guillain-Barré syndrome. The patient was admitted in Bombay hospital and he had entered into a multiple organ failure already. And he was like, doctors had said that now 10 hours, sorry, for him to survive. Meaning everything they had to do, they had done already. And when you are into that stage, family tries to get together as many people and whatever they can do. So I got a call that this is the case, you have to come. And I had said that it's not possible for me. A is that it's a hospital setup, so I need a permission from the doctors. I need a permission from the hospital. B is a case which is like already given up like this. It's with acupuncture, there are no chances that I can revive it back. They said, "Nee, you come. Once you come, just come and have a look, then we will see." At 11 o'clock night, I went to Bombay hospital. They gathered all the permissions and everything, and I went to the hospital. When I went there, we have a test here called as Accugraph. It's a pulse diagnosis test. I did the test. I saw there were certain energies which were very deficient in him. So I did what I had to do with absolutely zero hope of changing anything. And that just replenishing those deficiencies, believe me, I sent the patient back home. That was something which I had never anticipated. That was something which for me is nothing short of a miracle. That how is it possible?
That gives you a hope of, so many better things ahead.
That taught me that never say no, you
Yeah.
try.
Yeah.
Then leave it on one above, whatever has to happen will happen. But at least you try.
So when you integrate your practice with, say, the normal clinical diagnostics, and so how do you decide when a patient needs like a conventional diagnostics versus a traditional medicine, or blend of both of them, like acupuncture
So
and...
what happens is, generally when a patient, the kind of patients that we generally get are patients which are chronically ill. Like, no, they are suffering from the ailment for 15 years, 20 years, 25 years, like that. Okay. So what happens is, generally when the patient comes, they come with a bag full of diagnostics with them. Okay. So that part is already been done 90% of the time. Just when they come, we have to do our acupuncture diagnostic. We have to understand what patterns they are following and accordingly decide on the treatment protocol. Now, the rest 10% of the time when we will send a patient for any kind of investigation is only when our pattern differentiation and the symptoms don't match. That there is something beyond what the symptoms are telling me. My pattern differentiation is telling me something else. Please let us verify it. You go for certain so-and-so diagnostic skills, go for a blood test, MRI, EEG. Let us get it reconfirmed, and then we can go about it. So that is when actually it really helps, and I combine it.
So looking into the future, like, you've been in this profession for like 3 decades. So definitely you've seen a shift of what you used to do 25 years back to today, and like in the future with, in all facets, like in technology, you can say artificial intelligence. In yours, that might be an upgrade in the instrument that you use. Like needling probably was not there 25 years back, it's there now. What excites you the most in say in today's future, when you look at the future lens?
Like I said, we do one test. Yeah. So that's a pulse diagnosis. In 25 years back or ancient time, they would actually read the pulse. Now, reading was quite individualistic. No, how much I know, how much I can interpret is different. And there was no measure to it. Like I cannot do a before and after thing, that this was it and now this is it. So we have this acograph, which is like measuring the pulse of a patient. Gives us exactly like before I start a treatment, after I start a treatment. So I'll give you a very good thing. When I did my research with Tata Cancer Hospital on CIPN, we did like a full trial of 52 patients. All right. And I did 52 graphs of all the patients before and after. And we were able to capture on the basis of the graphs report that the pattern that they are following, all the patients who had come here, they were following a pattern of spleen Qi deficiency. So that we could do it only because of this modern machines that have come up with. So that's something which I regularly use in my clinic. But AI really excites me. There's so much to learn and so much we can understand out of it. Like primarily in acupuncture field, what we understand was what actually used to happen was that in the villages of China and all, acupuncture was taught from grandfather to father, father to son. It was not like, and it was kept as a secret. It was never open for everybody. Now with AI, we have different mindsets. We have the greatest of minds in the field of acupuncture, and all their work is available online. We just have to, like, for one simple symptoms, if I type, I want what Giovanni says about this, it will come to me. If I say that I want what Deborah Betts talks to me about that, like different, for the same thing, I will have 10 different opinions, 10 different mindsets which are telling me what can be done. So if I'm stuck in one, I will have 5 different approaches at a click of a button. So that is something which really, really excites me. But, and again, now with AI, life is becoming very easy because half of the diagnosis is also getting done with the help of AI. So that is also something which is very futuristic, that things are just a click away and we get to know everything.
And how have you navigated through these? I'm pretty sure, like previously, there used to be naysayers of acupuncture. People used to not regard acupuncture, and probably today more people have accepted it. And how do you still navigate through those naysayers versus people who actually want to get help from acupuncture? And in Indian culture, there is societal pressure like, no, acupuncture, no, doesn't help. Say if a patient wants to go to via acupuncture, there'll be all 10 family members who would be like, no, 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 go to allopathic medicine, just take that, that will help you. So how do you navigate that in today's time, and how it has changed as the mindset shifted, do you think?
A lot, a lot. And for me, it was always what my results spoke. So if a patient is getting better, he will always bring another patient to me. And that is where I have always put my focus on treating the patient, giving the results. The results has to speak, isn't it?
Yeah.
So, and like I said, patients that we generally get have tried all the pathies. If you fall sick, you will go to an allopath first, then you go to a homeopath, then you go to an Ayurveda, then you go to for acupressure, Reiki. Because needles are involved, I am the last resort.
Correct.
So they are very convinced that you are my last resort and you have to take me out of it.
Correct. Yeah.
This is a line which we hear very common.
Yeah. And say if today you're talking to an audience, bite-sized information, what are the three, or are there any like the three acupressure points or habits that you would recommend to start at home, or people who are still kind of on the fringe with any traditional medicine, I would say here, definitely in the US? Anything that you recommend to start to live a healthy lifestyle? As you mentioned, right? Prevention is better than cure.
Share a simple, normal routine that we can incorporate in our day-to-day life. Acupuncture is all about yin and yang balance, right? So as the day starts, you have to start and gear yourself with yang energy. And the best way to gear up the yang energy is through breathing exercise. So even 5 minutes of alternate nostril breathing, box breathing, anything that suits you, just 5 minutes, do it first thing in the morning when you're still in the bed, which means you are jump starting your day with yang energy. Then the whole day you start your work, no, you are too much into yang, because you are working, you are giving, all the information is outside. You are gathering information, you are giving information. So you are into that yang zone. So your productivity also increases when you start your day with yang. Midday, when you are exactly in the midday, because there's too much of yang happening, you have to now cool your system also. So just 10 minutes, if you can just close your eyes and sit for 10 minutes without any mobile phones or anything, that is again drawing your energy inward, that is bringing your body to a yin. After 10 minutes, again your yang starts. So you are starting from yang, yin, yang, end of the day, just 5 minutes. No, in our Indian culture, it is thought that end your day with a prayer or a gratitude. That is again drawing your energies inside. That is again you're getting into a yin. And night is when you sleep, is that you want yin to have a peaceful sleep, to repair and restore. So you are starting from yang, you are ending into yin. When you're doing this, automatically you are not allowing too much yang happening. So there is no inflammation in your body. There is no autoimmune condition activating in your body, because you are activating and you are cooling. You are activating and you're cooling your body. So this really, really helps if you can just incorporate 10 minutes. I'm not saying like you sleep for 2 hours in a day. 10 minutes, close your eyes and allow the energies to go inward. And you will feel so much fresh after that. And your productivity definitely increases, so that your work is not suffering because of that. So this is something which definitely I would advise all our viewers or listeners to practice.
Yeah, that's wonderful. And then finally, where do you see the biggest research gaps in acupuncture, and what has stopped it, growing as, say, any other medicinal field? Is it the social media or the publicity that it gets, or the negative publicity it gets, or where do you think there's this gap?
So I feel first gap is in acupuncture academics. in academics, like how in MBBS they teach physiology, anatomy, and then pharmacology. Similarly, in acupuncture also we should have the similar course with, instead of pharmacology, acupuncture. So there's a like in-depth understanding of the body. So that is one gap that I strongly feel needs to be bridged. Second, there has to be a lot of research. Of course, it's been happening now, which was not happening earlier, that when I put needle, I want MRI scans to show which area of the brain gets, like biomedically, which endorphins are released when I'm putting needle here, what cytokines are released. I want to understand that. And that, if we give that kind of understanding, the modern youth will understand it better. If I say that 5 energies and they have to be balanced, they say it's all rubbish.
Yeah,
but when I
true.
say that, okay, I'm putting needle here and your motor area of the brain is getting lit up, that's what they will understand. When I'll say that when I'm putting needle into, I'm stimulating your, for example, gallbladder meridian again and again, and your motor area is getting stimulated. What I'm doing is, modern understanding is that when I'm stimulating the gallbladder area again and again, I'm creating a neuroplasticity.
Yeah.
So that your motor area will be more active. This is, if I give this kind of understanding, the modern youth will understand. But if I say that, okay, gallbladder energy is energy which looks after your muscles and tendons and it will make it stronger, people will say, oh, it's rubbish. Yeah. But it's not rubbish. It's just that change of words and change of understanding needs to be done.
And then definitely social media, and then in fact, when you talk of the machine, the pulse machine that you spoke about, probably real-time MRIs, scans when you put the needles and all, might definitely help.
Yeah. And the studies are happening now. It's not that it's not happening, but it's happening, but it's at a very smaller scale. We need a huge scale for that.
True. And definitely the role of social media, you think, is helping in debunking these myths of acupuncture?
Yeah, I feel social media is really helping in creating an awareness. Earlier, people would think that acupuncture is only good for pains, which is not the case. We see so much of fertility patients. If your endometrium lining is not growing, with acupuncture, endometrium lining grows. And we have a sonography which is telling me on day 1 and sonography is telling me on day 2 what is the change happening only with needles. Right? So there is no pain involved here. True. But my endometrial tissue is growing. Right? So definitely it really, social media is helping us to create this awareness. For mental well-being, acupuncture is considered the best. Yeah. It releases stress immensely. Yeah. Helps for autoimmune conditions. There's so many conditions that, in fact, everything acupuncture can handle. Now you go to an allopath, similarly you come to an acupuncture. But yes, we have our own restrictions where there's a mechanical defect. I can't say that I can correct it. You will have to go to a allopathy doctor for that.
Yeah. And finally, if people want to know more about your work, your research, just acupuncture in general, how should they reach you, and your final words, final thoughts?
So they can reach me through my website, that is JasmineModi.com, and my Insta handle is Jasmine Modi. So they can reach me through that.
Awesome. Thank you so much, Dr. Modi. And definitely people have gained so much insights on acupuncture, and I've loved the conversation that we've had. And hopefully next time we can go in depth of your bladder cancer research and also some things about gut health. So thank you so much.
Sure. It was lovely talking with you.
Thank you so much for staying till the end and listening to the podcast. I hope you have enjoyed as much as I have bringing it to you. Please share it with your family and friends who would want to use this information to challenge the status quo and think from a different perspective. For more bite-sized information, follow me on Twitter at TulipSNandu, and to receive interesting take on current topics, subscribe to my newsletter at tulip.substack.com. Until next time, go beyond the optics, friends.